Healthcare professionals face many complicated and high-pressure challenges in their daily operations, whether they take place in traditional medical facilities or on the battlefield. Both settings require innovative, comprehensive training solutions to improve patient outcomes. With over a decade of medical simulation experience, ECS offers a variety of blended solutions and services that include a full range of medical simulations, virtual worlds, serious games, and global simulation centers, all with a focus on enterprise learning management.
Choosing wisely. Open the lines of communication to help patients choose wisely. Choosing wisely provides physicians an immersive and interactive experience to expand upon the knowledge and essential skills in guiding patients through their diagnosis and treatment options. Choosing wisely features avatar-driven scenarios representing special patients in challenging situations.
That sounds nice, doctor. But what I was thinking, maybe I should have an MRI done, because I think something seriously has gone wrong. I might have a pinched nerve or a slipped disc.
Physicians must demonstrate appropriate strategies for having difficult conversations about the most feasible treatment options and strategies for care. Through a simulated learning environment, physicians assist patients in making informed and wise decisions about their healthcare choices to improve treatment and clinical recommendations. The best patient care begins with the decision to choose wisely, accurately, and in a timely manner. Crash cart countdown. In a moment of crisis, rapid response team members have very little time to provide advanced life support. Efficient, accurate, and customizable, ECS's Crash Cart Countdown game design improves memory, concentration, and recall speed in life-threatening situations.
Good job! Please give this to the patient.
Crash Cart simulates medical situations involving various types of crash carts, randomizes prompt sequences to enhance cognitive recall, rates players' time efficiency, accuracy, and complexity, tracks high scores, and inspires readiness through competition. Emergency preparedness is only seconds away with ECS's Crash Cart Countdown. Clinical skills. Make the shift from emergency care to routine patient care with ECS's Clinical Skills mobile app. Equipped with a variety of conversation-based scenarios, Clinical Skills Deep Learning Environment prompts learners to use specific approaches while conducting patient interviews and allows learners to interact with medical inventory items to take vital signs and perform physical examinations on realistic patient avatars. Clinical Skills mobile app bridges learning environments to enhance quality of care by including essential environmental cues and instructional feedback. The result is learners using proper sequencing, reinforcing patient interview techniques, and incorporating productive patient dialogue, all while honing diagnostic reasoning skills that can be applied to a number of situations, both in regular checkups and even in more severe cases where extreme sensitivity must be used. Goals of care conversations. Connecting knowledge and experience in a risk-free environment through goals of care, physicians take a journey with terminally ill virtual patients and their families to build skills and confidence in having goals of care discussions. Featuring diverse perspectives in its clinical cases and realistic critical conversations through role play, Goals of Care helps practitioners identify learning gaps, gain a new mindset, and take risks to learn.
I hate it. I can't do anything without getting worn out. And it's awful to be practically helpless. My son-in-law has to do all of my yard work now, and that was always my job.
Proper goals of care conversation skills help patients obtain a better understanding of the possible outcomes of their care and the implications, both positive and negative, that accompany those outcomes. Tella ICU. Tella ICU is a multiplayer environment designed to train individuals concurrently through team communication scenarios. The simulation focuses on the complex decision-making process required between bedside clinicians and remote critical care teams. Together, teams check patient vital signs, medications, labs, and statuses to treat the patient. Users have to respond with appropriate interventions depending on how the facilitator progresses the scenario. An event tracking system records quantitative exercise data, enabling replay and analysis of completed scenarios. Instructor-led collaborative feedback allows users to analyze decisions and their outcomes.
ECS has provided medical education and training services for healthcare providers and patients alike. Our solutions have been used to train numerous procedures and policies across the entire continuum of care. From the soft skills required to interact with a patient, to the identification and treatment of an injury, all the way through patient aftercare. What's your challenge? Turn to ECS for solutions.